regarding the endocrine factors and the effect of aging, which is the order of the day. And we are also going to see that how aging alters the hormonal status and the degeneration of the cells, which leads to the decline of the hormones, which has been recognized as one of the greatest risk factor for various chronic debilitating diseases, and which has been recognized worldwide. So coming to aging, aging and increased life expectancy is the order of the day because when we are looking at the metabolic functions, the biochemical reactions of the body, and the total body chemical composition, which declines due to aging, which also affects the bioavailability of the hormones into the blood circulation, then it is for a known fact that whenever there is a reduction in the quantity of the hormones in the blood, that it also means that if we maintain the right amount of hormones, it can be an anti-aging elixir. So this is the whole gist of the talk today. So it is said that it's a natural phenomenon, it is inevitable, it is irreversible. But again, we are going into the details of the facts about aging, anti-aging, and longevity. So about aging, it has been known to everyone that it is nothing but the progressive sequential physiological manifestations leading to the decline of the biological functions, and the which affects the day-to-day daily activities of the person, and the inability to adapt to the metabolic stress. So understanding the mechanism of aging and paying attention to the hallmark features of aging, which is very much beneficial in delaying aging, and also helpful in prolonging the life, uh, of course, the longevity, and in order to make the person or the aging person to lead a normal, healthy life. The longevity, again, it is independent of the biological aging process. It's nothing but the length of the lifespan, which is very much independent of the biological aging process. So these I have quoted some of the age-related disorders, but the list is endless. But just the few ones are being described over here, and I may not go into the detailed list of it, but no, one or two I would be talking more about, like dementia, Alzheimer's, osteoporosis, of course in postmenopausal women, and insomnia and depression. These are the few of the causes which are due to the hormone decline. Coming to the theories of aging, I again don't want to go into the details because again it will be a very long talk. So here we have the oxygen-derived free radicals, the reactive oxygen species, which are the culprits, which is known theory all around the world. Apart from that, the immunological theory and the mitochondrial theory, which again it is also a known fact that increasing lifespan is directly proportional to the antioxidants, so that it can scavenge off the reactive oxygen species and helps in the longevity. Then finally, let us talk about the hormonal theory. So the endocrine factors affect aging, and aging alters the hormonal status of the patient, or the person or the aging person. So it has been recognized as one of the very risk factor for the chronic debilitating disorders. Then finally, we would be talking about the microbiome and aging, because the microbiome is recognized as directly or indirectly related to the aging process. So, and how are we going to use the microbiome as our anti-aging strategies? Then coming to the role of hormones in aging, so because the endocrine system is affected, which alters the production and secretion, and also the catabolism of hormones, because there is a general thinking that whenever there is a decline in the hormones, it's a normal part of the aging, and nothing can be done much about it. But that is not so, because biological hormones play a crucial role in the physiological and psychological processes, in maintaining the homeostasis, electrolyte balance, obesity, uh, overall wellness. Then, because anti-aging has been the has it has become a functional medicine, you can say, which is focused on keeping the hormone levels optimal, especially when age progresses, so that in order to help in longevity, to prevent diseases, and to maintain a high quality of life. So still, when we look into each and every hormone, especially few of the hormones have been coded here with the target organs, like for example, adrenal glands. Then it's all known to everyone, but still, I just want to brush it up briefly about aldosterone and adrenaline. Here, the graph codes. Here, it shows how there is a decline in the hormones according to the age, because this is the hormone which helps in the electrolyte balance, maintaining the blood pressure, homeostasis, also functions well as an anti-inflammatory hormone, and helps in glycolysis, gluconeogenesis and lipolysis, the breakdown of the fat. So due to aging, there is increase in the fibrous tissue, and the medulla of the adrenal gland will not be able to process the hormones due to the degeneration of the cells, also due to the formation of the fibrin, and also the release of the neurotransmitters, because the low released or the reduced release of neurotransmitter, which ultimately leads to low vitamin D synthesis. Due to that, there are few effects of aging, like the declining cognition, impaired memory, blood pressure fluctuations due to the electrolyte imbalance, increased toxicity, and of course it can go into some of the serious complications like acute renal failure, decreased glomerular filtration rate, of course depression. Then DHEA, the most abundant steroid hormone in the body, which will be helpful in the replacement of tissues, and helps in helps to maintain a healthy immune system. So again, the production of this neurotransmitter is so crucial, of course, in maintaining the long-term memory or short-term memory. uh, and there is imbalance whenever there is imbalance due to the aging. So of course it explains the fact that there is impaired memory or the memory loss in the aging population. So high cortisol and low DHEA, these are the serious risk factors for atherosclerosis, diabetes, obesity, and of course it accelerates the aging. That is the reason we have to look into the restoring of this important hormone into the circulation, blood circulation. Coming to pituitary gland, known as the growth hormone, known as the youth hormone, uh, and the functions. Of course, it's known because it also helps in the maintenance of the immune system, improve the enzyme production, enhance the energy levels, enhancement of the stamina and the strength, uh, um, improve the bone density, and also enhance the integrity of the skin and the hairs and the nails. So, because this is the hormone which is much responsible for the tissue repair, cell regeneration, that is the reason the effect of aging can be osteoporosis, it can be insomnia, it can be the dryness of the skin, and the other uh, uh, enhancement of the other debilitating disorders, because the immune system will not be intact in the aging population, so they get prone to number of infections and disorders. Coming to the thyroid gland, here uh, the graph very well depicts the how declines, the steep decline is being observed from the adulthood to elderly, which is being described over here, and it is being retrieved from the Medical Council of Canada, and the male and female hormones are not being differentiated over here, but of course, overall, when we look at the overall picture, we can see the healthy functions, like which controls the energy metabolism and regulates how much energy is stored as fat and how much is released into the bloodstream for the metabolic processes of the body. It also controls the sleep patterns and maintains the cholesterol balance and other vital functions of the body, just as, for example, digestive function and immunity. So, effect of aging is nothing but the decline of the hormone. Due to the decline of the hormone, it can be cognitive impairment, the mood swings, you can say, or the mental decline, memory loss, due to the low levels of thyroxine in the blood circulation. Coming to the male testosterone, because we have mostly focus on the male testosterone level here, which how it declines with age, and the healthy functions. It's already known to everyone. The reproduction, and also it has a great role in the protection of the heart muscles and the cardiovascular system by keeping the cholesterol and the electrolyte balance, which also helps in the motivation, confidence, build-up of the confidence, and intact bone density. Now, coming to the effect of the aging due to decline of the testosterone, it can be impotency, or it can be the late onset hypogonadism, because there is a decrease in the lean muscle and increase the body fat, and low stamina, low libido, or all the aging effective functions due to the low testosterone in the blood circulation. Okay, here when we talk about the estrogen, we have focused mainly on the female hormones, the female values of estrogen, and everyone is aware of the functions and the role of estrogen in reproduction, and the role of estrogen in preventing the heart disease, cerebral vascular accidents, strokes. Decline of the hormone ultimately leads to osteoporosis, Alzheimer's, mood swings, memory loss, dryness of the skin, eyes, and of course the vagina. Then, so overall, the cognitive activity will be lowered due to the decline of this important hormone uh, in women, especially. So when we talk about the progesterone, also the same effect can be seen in aging population, and because the progesterone is an important factor which prepares the uterus for the fertilized ovum, it receives the fertilized ovum, maintains the pregnancy, and of course it has got a great role in being anti-cancerous, mm, and it helps in the deposition of the calcium in the bones. So ultimately, when due to aging, when there is a decline in this important hormone of the body, it affects the uh, bone density, leading to osteoporosis, of course, ovarian cyst, endometriosis, fibrocystic breast, uterine fibroids, and all the age-related disorders. And when we talk about the pituitary gland, which is very important, the growth hormone, the luteinizing hormone, the follicular stimulating hormone, oxytocin, prolactin, thyroid stimulating hormone are all being released from the pituitary gland. And due to the degeneration of the cells of the pituitary gland, the generally functions like general growth will be affected, and there will be impaired protein production, and imbalance of the fat distribution in the body, which also affects uh, the overall body, and give rise to some serious complications, like abortions, infertility, and so on. Coming to the pineal gland, the biological clock, it is also a very well known fact about the melatonin, which is nothing but an intracellular antioxidant. The vasopressin and adrenocorticotropic hormone, everyone is aware about the functions that electrolyte balance, it maintains the electrolyte balance, the water retention, and maintains the blood pressure, and it has got a great role in the sleep wake cycle. Of course, it is anti-cancerous, anti-stress, and also suppresses the effects of the cortisol. Coming to the effects of aging, the electrolyte imbalance, fluctuations in the blood pressure, depression, and other immunological mechanism, which makes a person prone to infections and other debilitating chronic disorders. Um, Now, coming to one important aspect of aging, because when we are going to talk about the anti-aging therapies, the role of microbiome, and how it affects the microbiome affects on menopause, the effect of microbiome on menopause. So it is very much recognized the age-related shifts in the vaginal microbiome, and it has been recognized and also um, approved by a lot of studies, the fading of the lactobacillus species, and of course it has also been evidence, it has been evidenced by different studies, the increased concentration of odorobacter species in the premenopausal or menopausal or the postmenopausal women. That is the reason the role of a microbiome is very important, because again, when we are talking about the anti-aging strategies, and then we are going to see how we are going to tackle this issue of the microbiome composition. Then coming to estrobolome, I know this term is not very well versed with many of us. It is nothing but the deconjugation of the estrogen and progesterone by the gut bacteria, like the Firmicutes and Bacteroides species. So the impact of estrobolome activity, which has to be elicited in estrogen-mediated malignancies, you can see uterine cancers or ovarian cancers or breast carcinomas. So the postmenopausal woman has a higher abundance of some of these species, which are being written over here, the megamonas and lactoclostridium kind of species. That is the reason it has been recommended that the periodic screening of the gut microbiome, vaginal microbiome, and skin microbiome is recommended at a regular basis to screen out the abundance of the species, which directly or indirectly lead to the aging disorders. Coming to one important aspect of our laboratory, there's nothing but the hormone quantification bioassays in the laboratory. Um, So I have quoted some of the equipment which will be useful in the quantification of the hormones in the laboratory, like very sensitive and equipment, that is the enzyme-linked immunosorbent assay. So which has been supplied by a lot of vendors here in Canada. And of course, the turnaround time is just 2 days. So And the plasma or the serum is the sample which can be used, and it will give the quantification of the hormone. So again it depends on the kit which we are using. So different commercially available kits are there in the market. We can so for the quantification of the hormone, here I have displayed this testosterone and triiodothyronine in ELISA kit, which can be the sample processing will be there, and after that uh, the conjugation and the enzyme will be linked to that, and then again it will be washed, and finally we can read the in the ELISA plate reader. Coming to tandem mass spectrophotometry, again, very important equipment in the quantification of the hormones in the laboratory. Here, the microplate spectrophotometer, and again, there are UV based and spectrophotometers which are available in the market, and especially supplied by Thermo Fisher Scientific. I have seen that they are quite sensitive, and of course the specimen is very feasible. The blood or the serum can be used, and the turnaround time just 2 days, and we can get the results of the hormones. Okay, so these are the few of the quantification of the steroid hormones in the serum or the plasma by the mass spectrometry, and which is being displayed over here. Coming to the innovations like automated lumipills, which is not much used in the laboratories, routine laboratories. Here, because the turnaround time is just 1 day, and it can quantify the hormones based on the kits what we are using, and of course the specimen is very feasible. Blood or the plasma can be used in this equipment. Okay, this is the slide I have displayed to have a vague idea about the procedure, how it will be done, and in the quantification of the hormones in the blood or the plasma. Okay, coming to one important aspect of anti-aging and longevity, that is the anti-aging strategies. So it has been shown that aging is an irreversible phenomenon. It is believed that it cannot be restored. Age cannot be restored, but that is a myth now, because the fact that hormones decrease with age, of course it's not a good news, but here we can attempt the hormonal therapy to reverse the hormonal decline, to activate the degenerating cells, to for the production of the hormones, to combat the progression of the age-related disorders, Alzheimer's, dementia, etc. So HRT, the hormone replacement therapy, where now it has become very feasible because the melatonin and progesterone supplements can be purchased over the counter from the by the doctor's prescription, and other issues with HRT. Of course, there are some of the risk factors which are involved and the side effects which has to be kept in mind before the uh, use of the synthetic hormones. Because there are varying opinions I have seen in the literature about the whether the benefits outweigh the risk, whether it will shut down the body's own release of hormones. So how come it's going to be beneficial, is uh, the issue which researchers have to still investigate before uh, getting into the uh, results. Coming to the stem cell therapy for anti-aging, so the mechanism is quite feasible and easy, like the activation of the autologous stem cells, or it can say self stem cells, to replace the damaged cells, or to activate the degenerating cells, for example, in the pancreas. So here the multipotent neuronal stem cells in the mammalian brain, which will proliferate and which will form the glial progenitors, which migrate towards the site of the lesion whenever there is an injury or maybe due to aging or any other factor, and which makes them functional so that the hormones can be released. So reactivating own stem cells replenish the degenerated cells of the tissues. There are restore healthy hormone levels in the blood, and which affects, of course, the local inflammation will be restored so that the cells gets activated and maintains the uh, hormonal function so that the normal levels of hormones will be into the blood circulation. So, coming to the therapeutic interventions, of course, the stem cell therapy, which is again widely available, uh, and so few advantages are there, like it can be organ specific or a short term usage, because it promotes the healthy cellular renewal of the uh, degenerated tissues, and of course, there is no antigenic stimulus, and it is very feasible because it is available as oral soft gelatin capsules, and the advantage is that the degenerated biomolecules are replaced by via the same pathway as the endogenous products. So it again, it has got a very good advantage that it can be used in conjunction with other treatments which the person may be undergoing. So this is like for example, you can say some of the hormone molecules which can be regenerated in the endocrine glands, and so that the level of the hormones can be restored in the blood circulation. Coming to the very important aspect of it, of course, the transplantation of the microbiota. So here, the donor from the donor, the microbiota will be harvested from the donor, and you can say the live probiotics will be harvested from the stool of the donor, and which can be infused into the colon of the uh, person or the aging person to restore the gut microbiota. So that you see here we can, for example, the spores of the keystone species or the lactobacillus, the bifidobacterium, or bacteroides. These are the few bacteria which can be harvested and from the donor, and through colonoscopy, or you can say through the retention enema, or through the intubation, or through the route of the duodenal infusion, endoscopy through endoscopy, or even orally as a pill can be administered into the recipient, and the healthy microbiota can be, and the gut microbiome can be restored. So that is uh, that is nothing but the intestinal microbiota transplant, which is the therapeutic target to promote healthy aging, and this is one of the form of the biotherapeutics, which is taking a hold in the anti-aging market and in the longevity sector. So, coming to the aspect of bacterial therapy, as I told you, the spores or the life cultures of the keystone species can be harvested from the donor and implanted through intubation, through colonoscopy into the recipient. Uh, so again, the gut microbiota is increasingly recognized as a regulator of host immunity, and also the brain health. Of course, everyone is well aware of the gut-brain axis, and also neuroimmunity, during the aging process. Um, then some of the other candidate strategies or which are getting popular. For example, the active marine peptides, which are increasingly recognized as anti-aging drug candidates, and which reduces the oxidative stress and the scavenging of the reactive oxygen species ROS, and which of course maintain the normal redox levels, synthesis of the antioxidants and the enzymes pertaining to the antioxidants, and also inhibits the lipid peroxidation. Peptide drugs supplemented with antioxidant analogs reduce the oxidative stress, and which also improves the antioxidant capacity, and to delay the or I can say to prevent the age-related pathologies. So um, this is getting very popular, and of course, it is one of the experimental research programs for the researchers like us to investigate more into that. So gene or cell or DNA therapy, which is again one of the form of the revolutionary medicine in the declining the effects of the aging to restore longevity, and the telomerase gene therapy, and has also provided a lot of insights into the anti-aging strategies. Coming to the nutritional supplements, the pharmaceutical doses or the herbs, you can say, which produce more of its own hormone, so there will be less of the antigenic stimulus, or it can be absorbed into the body, like the pharmaceutical doses of the bioidentical hormones, or you can say which helps to improve the body's own release of the specific hormones. So the tolerance will be more because the body produces its own hormones. So I have got one example over here, the example of the selenium, which is able to convert the thyroid hormone T4, storage thyroid hormone, into active T3 hormone. So here, adrenal glands require vitamins and minerals as dietary supplements to function properly. So the medulla of the adrenal gland, whenever it is going into the fibrous state, will get degenerated. Whenever it's getting degenerated due to the aging, will restore its function by the vitamins and minerals and functions properly. So deficiency of vitamins and minerals will decrease the biological functions, and which will affect almost all the hormones of the body, especially in aging conditions. So it can be a very good strategy uh, in the longevity process. So as a note, I would be saying that aging is not a disorder. So the normal myth that aging is an irreversible phenomenon is not in the picture, because hormones decrease with age, but there is no reason why we should not try to prevent or at least delay the damaging effects uh, by restoring hormones, and to overcome the hormone deficiencies, and by the lifestyle modifications, by shedding off the weight, exercise, calorie restricted diet, and of course, whatever the strategies are being mentioned over here, that the transplantation of the healthy microbiome, because it's never too late to start a step towards longevity and towards anti-aging. These are the references, and if there are any questions and answers, I would be happy to answer. So this is the end of the talk and webinar today, and I hope everyone had a great time. In fact, I too had a great time in delivering this talk. So this is the end of the webinar.
Well, thank you so much, Dr. Fatima. It was really insightful, and I guess everybody loved it because this is something that's really new to the world and how the hormones can impact. Now, we'll like to take the questions from the audience, and if you have any questions, I would really appreciate if you can drop it in the chat box. I'll definitely be able to ask the questions to Dr. Fatima. So, if you have any questions, please feel free to.
I took half an hour.
Mm.
Yes, so
Hi.
we have.
Hi, Dr. Sabina. This is Nera. I just raised my hand because I have a question. Thank you so much for your nice presentation. I really enjoyed the topic. And can I ask you a question about
What is it?
can you hear me?
Yes, I think she would be able to
Yeah.
answer the question. Could you please repeat your question?
Yes. Thank you, Dr. Sabina. Thank you for a nice presentation. Um, Actually, I really enjoyed the approach that you mentioned about uh, the therapy and the therapeutic approach for anti-aging. But my question is about that. Is there any possibilities, or is there any approach that we can estimate the initial phase of the aging in everyone, which is like the individual approach for everyone to understand uh, in what stage and in what phase are there about the aging?
No,
Yes, thank you so much for that question, Nida. I think we are facing some technical difficulty. Dr. Fatima was not able to hear this question, so if you could just type in the question, I would be able to ask her.
oh, okay. Okay, I have to type.
All right, yeah, so now Dr. Fatima is back. Sorry for the inconvenience. Are you able to hear to the participants, Dr. Fatima?
Yes, I can see the questions over here
Perfect. Thank you.
in the
So, if you
chat.
can just address the first question that we have is from Raja, stating that menopause is associated with aging and changes in gut microbiome, specifically which organisms. So, he would like to know what organisms are contributing to that.
Yeah, it's a very good question, and I would be happy to answer. Menopause is associated with the decline of the lactobacillus species, which also we have witnessed in our lab whenever we have processed the vaginal microbiome screening. So, especially and other also keystone species which gets diminished with the aging. and ultimately leading to menopause and all the menopause related complications like osteoporosis and other decline of the hormones. So usually we have witnessed ourselves in our lab the lactobacillus species which will decline, especially in menopause. And some other questions I have seen here, menopause. Associated
Yes.
with aging,
So,
yes. Changes in the gut microbiome, because I have been telling that the lactobacillus species will be reduced, the bifidobacterium and other species, the Rhamnococcus species, and other keystone species will be reduced in menopause, which ultimately um, uh, uh, directly or indirectly affects the reduced production of the reproductive hormones, especially estrogens and progesterone. Um,
perfect. Thank you so much for that.
Yes.
We have a question from Neda stating that is there any approach to understand and measure the initial phase of aging in each person? And I think Raja is on the same page, is to understand the initial phase of aging in each person.
Yes, because whenever we are going to screen out the initial phases of aging in each person, we can quantify the bioavailability of the hormones in the blood circulation directly in the plasma or the serum, and also we can subject the person to the periodic screening of the vaginal microbiome, so that we can have a vague idea of whether the person is into the premenopausal stage or uh, initial phases of the aging. We can make out, so it will give us an idea of the vaginal microbiome screening and the quantification of the hormones in the laboratory.
Thank you so much. We've got another question from Sahid stating that going forward in the future, what are the major knowledge gaps that still needs to be discovered and understood to continue this field of science?
So, as I told you that this is nothing but we are talking more on gerontology. Gerontology is nothing but the science of aging process. So, lot of inventions and insights are being recognized. Because of course everyone is interested in longevity, so the hormonal screening, for example, is one of the major factor which should be understood, and in this field of longevity, and to tackle anti-aging and aging related disorders. So bioquantification of the hormones and screening of the microbiome, not only the vaginal microbiome in postmenopausal women, but overall the skin microbiome screening and the uh, gut microbiome, which gives us a predictive analysis of the process of the aging or the initiation of the process of the aging. So it will give us a kind of the predictive analysis, you can say, the prediction of the future, that whether the person is going into the complications of the aging, and how we can restore the microbiome so that the anti-aging strategies can be applied, what are the other anti-aging strategies, and the complications can be avoided.
Wonderful. Thank you so much for that. Now we have another question by Patty stating that where can we get that test?
Okay, we can get the test in the laboratory. Uh, and for microbiome screening, BioAro is the laboratory where the vaginal microbiome and the gut microbiome screening and the skin microbiome screening can be done. And that can be done in our laboratory as well. And apart from that, the other equipments which are being shown over here, ELISA is also one of the um, very usual equipment in the laboratory nowadays. So that can be done. And the spectrophotometry, of course, and the lumipulse, which is being shown, is also getting very popular into the market. And the only drawback is it has to be we have to contact the vendors, but they are somewhere in Europe. So in fact, I have contacted few of the vendors, and they are interested in the market in Canada as well. Okay,
Thank
from Dr. Meenal, telomere length is now the area to explore. Yes, I do agree with that because among the anti-aging strategies, the telomere length, the shortening of the telomere length is the new area which has to be investigated more, and so that it becomes feasible for each and everyone to adapt to it so that they can tackle the anti-aging process. Yes, BioAro can do yes, Dr. Raja. BioAro can do the vaginal microbiome screening, gut microbiome, and the skin microbiome screening as well. Hormone test, yes. We can go into hormone test. The ELISA based test, which is a routine laboratory test, again, it is based on the different kits, and spectrophotometry also can be done. Mm. Telomere change reversible? Yes, it is, because again, a lot of investigations are needed for that. In fact, cost, I'm not sure about the cost because I'm not into that at the moment.
By the cost, I think Patty meant how much would it cost to have these tests done at BioAro?
Hmm. About the cost, I'm not sure of that, and whether viral can determine the telomere length by WGS.
Sure.
Yes.
So yeah, just to let everybody know, the cost of microbiome testing would be $450. If you have issues or concerns with skin microbiome, gut microbiome, vaginal microbiome, and oral microbiome, all the tests are done at $450. Now, another question before we wrap this up. One last question is whether BioAero Lab can determine telomere length by whole genome sequencing uh, that we are providing.
As of now, I don't think we are into that. But as and when we progress into that, we can also uh, measure the telomere length.
All right, thank you, Dr. Fatima. I really appreciate, and for all the questions that has been answered, I hope it has been a really great experience and knowledge sharing session for the participants as well.